Today I'm going to walk you through one of our most advanced tests that we have, and this really is the epitome of personalized medicine. What you see behind me is what we call a metabolic pathway map, and this is actually mine here, so we can go through mine. This is essentially all of the genes that exist in the human body of mine that are put in relation to various different metabolic pathways. So what you can see here is some green spots, some yellow spots, and some red spots. The green spots indicate that there is no variance or no mutation on that gene that is involved in that specific pathway. In the red one, we note that there will be some variation or some mutation in that gene, and therefore it will affect the corresponding metabolic pathway in a certain way. This map represents many things. The first thing that it represents is that as you could go through various different sections of the map, you'll see different pathways that are specific to different conditions. You'll see cholesterol, you'll see inflammation, you'll see things that are in relation to cardiovascular, you'll see diabetes, insulin resistance, right through to things like Alzheimer's and thyroid, mental health and neurotransmitter control, and also things that go further down into the more advanced preventative health strategies, such as the longevity pathways. So we have things that are pathways that are involved in methylation, cellular cleaning and renewal, and oxidative damage, oxidative stress. One of the reasons why this is the epitome of personalized preventative health is that if you see on various different pathways of this map, we can assign specific active ingredients, be that from foods or be that from supplements, that are involved within that pathway that can go on to correct any variant or mutation that you have. So many of us will be familiar with the concept of epigenetics, meaning environmental factors that can change, upregulate, downregulate, turn on, turn off various gene expressions that we have. When we look a little bit closer at some of the sections of these maps, you'll see that there are specific genes involved in specific pathways that are assigned specific active ingredients that will upregulate, downregulate that specific gene. One of the good things about this map is it really visually represents how all of our metabolic pathways are linked. So many of us will know that if we are diagnosed with high cholesterol, let's say, the doctors are very quick to tell us that we are at a higher risk for type 2 diabetes, Alzheimer's, various cardiovascular events, and this map represents why. So as you can see here from the cholesterol, you can follow it down and see how it's very much linked to Alzheimer's. You can see how insulin, type 2 diabetes, even weight management and cardiovascular are involved in the cholesterol pathways. If we go one step further, many clients that present with difficulty in sleeping or maybe something that's not right in the gut, we're able to understand that if we follow these things to the root causes, and here, as you can see from the map, it may be that sleep patterns and the gut is off because of the neurotransmitters, dopamine or serotonin. Furthermore, if we go to the center of the map, we can look at one of the most important pathways that is involved in the human body, which is our methylation pathways. So as you can see, various different pathways, all interlinked, really show us the importance of a root cause approach to preventative health. Another reason this is the epitome of preventative and personalized health is many of us go to the doctors and one of the standards of testing is a blood panel. Now, a blood panel is great. It's a snapshot of you at that point in time. But what that blood panel doesn't tell us is why the markers present as they do. So in the example of cholesterol, you'll go to the doctors, you'll do a blood panel, and they'll check for your lipid profile. In that, we may see some elevated markers specifically related to, let's say, LDL. So the blood panel will tell me that your LDL is high. However, the reason that is high, the blood panel doesn't tell me that. So are you producing too much cholesterol in the liver? Is it a case that you're converting too much of your good cholesterol into bad cholesterol? Or is it a case that your cholesterol production is actually fine, however, your arteries and your blood vessels aren't clearing this from the system? This map allows us to understand the why behind not only cholesterol in this example, but other metabolic conditions. So why is your cholesterol high, and what are some of the things that you can do specifically for your cholesterol to control it? Why do you struggle with weight management? Why is your thyroid not behaving the way that it does? Why do you feel the symptoms of anxiety and things like that more so than your partner or your sister or your brother? So this map really allows us to understand the why behind these chronic conditions. It's appropriate for if you present already with high cholesterol, high blood pressure, you're already on antidepressants, we're able to understand why the symptoms first presented from a biological point of view. It's also helpful if you're on a journey for preventative health and increasing your health span is something that you want to work on. And the reasons for that is we are able to understand from a genetic predisposition point of view, what are your risk factors for various chronic conditions? And one step further, what are the specific strategies that you can implement that are in line with those risk factors? So I'll walk you through some of the case studies and some of the types of clients that we have that have done the map and that we think it's appropriate to do so. The first is high cholesterol. So a blood panel will tell you that your cholesterol is high. The blood panel will not tell us why that cholesterol is high. So are you making too much in the liver? Are you converting too much of your good cholesterol to bad cholesterol? Or is it a case that you are just not removing that cholesterol from your blood vessels? This map allows us to understand why your cholesterol is high. Those are some of the examples of why it can be high. And the value in this is that we can get a lot more targeted with the advice that we're going to give you. As you can see from this part of the map, there are a lot of different things that are involved when it comes to your cholesterol. One of the things that we use the map for, and we've seen a lot of benefit for, is firstly, if you are somebody that chooses to go on the medication, which medication is appropriate for you? We can see in the example here that because of some variants in this gene, maybe statins, which is the first line therapy for most people, isn't actually appropriate for you because you wouldn't respond to it. Secondly, we are also able to understand, once we've established why your cholesterol is high, which of the genes and pathways are involved, we're then able to understand these specific supplement, if that's the route you want to go down, or these specific active ingredients in your diet that you need to prioritize to lower that cholesterol. The reason this is beneficial is when you think about supplement protocols and you think about even medicines to a certain extent, we can go off trial data and we can do some exercises in prescribing what we need to. You take it, you test it, we retest you in 3 months, we see if you responded. This takes the guesswork out of it and allows us to get to the specific recommendation that we need to from the start. So there'll be no time wasted, there'll be no experimenting. We know that based on your genetic metabolic pathways, these are the active ingredients you need to prioritize. So some of the case studies that we have for people that have done the test or people we think it's appropriate for, mental health is a big one. So you may be a client that is currently on antidepressants. You may be a client that struggles with things like anxiety, overthinking, catastrophizing. You may also be somebody that's struggling with ADD or ADHD. So this metabolic pathway is very appropriate for you, and the reasons are that, as we can see over here, we can map out how your neurotransmitters behave in the human body. So the two main ones are dopamine and serotonin. Now, for a lot of people that struggle with mental health conditions, we know that there's something that's going on that is involved in either the production of dopamine and serotonin or its metabolism. So in this example, we can see here that this person, who by the way does struggle with anxiety and does struggle with things like overthinking and all of those type of things, we can understand from this pathway that they have a problem in the production of dopamine, but also any dopamine that is made is not around in their body long enough for it to be used. And as a result, those are the types of symptoms that present. We also know that the client that we did this map on and the case study that we're talking about is, as well as anxiety and as well as overthinking and all the things that come with that, they also struggled with sleep. So falling asleep was a problem. We also understood that they had some gut issues. We are able to understand from here that when you follow the dopamine and serotonin pathways, melatonin and gut microbiome are very, very much heavily influenced in this pathway. So as a result, our strategy for that client was to support them with supplementation and specific dietary recommendations to increase the production of dopamine, but also other supplements that they are taking to help them to allow the dopamine that has been produced to stay around long enough to mitigate the risks and all the symptoms of anxiety. So some of the clients that we work with are on a fertility journey. That could be that they have tried to get pregnant and conceive for a while but have been unsuccessful, or they are somebody that are about to embark on their fertility journey. So one of the things that we do, in addition to this map, is a fertility panel, but this map is very important when we think about male fertility and female fertility. And the reasons being is for this methylation pathway in the middle. Some of the case studies for women that we have added value to is we are able to understand how the DNA is methylated. More importantly, for somebody embarking on a fertility journey, how well they are able to use the folic acid. So for those of you that don't know, folic acid is a standard supplement that women that are trying to get pregnant or are pregnant take as part of their routine, and the reason for that is to protect the baby from neural tube defects. Now, folic acid is converted into the active form, which is methylfolate, and this is the form that is absorbed and is going to be of use to us. We are able to understand if this pathway functions well enough. In the example here, you see that because of a variation on a gene here, when this lady's or if this lady were to take folic acid, she wouldn't convert it into the methylfolate, which means she wouldn't absorb what she needs to, which ultimately would affect her pregnancy. So in the preventative setting, we're able to understand that anybody that has this pathway or anything wrong in it shouldn't take folic acid, but they should take methylfolate instead. So in the preventative setting, this works. And also it's a key pathway that we test for people that have had unsuccessful fertility journeys to understand what are the specific supplements that they can take during their pregnancy to make sure that they are having a healthy, happy pregnancy. Being in the longevity and health span space, we offer various different types of advanced therapies. These include peptides, exosomes, stem cells, and so on and so forth. This map provides us a lot of value in understanding which of those advanced therapies are appropriate for our clients. If we think about peptide therapies, you get some people that respond to them, some people don't respond to them. They are a big financial and time commitment when you're doing these cycles, so it's important to understand the correct ones that are going to work for you. From the map, we are able to understand a lot when it comes to the longevity of our clients. We're able to understand various gene expressions, which most of us would be familiar with, but not only understand whether they have the genes, but how much of that gene expression they have. And secondly, and most importantly, what are some of the active ingredients in the supplements that they're going to take, in the food that they're going to eat, that will specifically help them with that pathway. Now, what helps me and what helps my sister, my brother, is completely different. We're all really, really individual. This map represents that. So another case study and clients that we've done this map on before within the oncology space. So we help a lot of people and patients during their chemotherapy and oncology journey. We also work with our clients after and post chemo and post cancer. And this map allows us to understand the specifics in helping them in preventing reoccurrence of their disease. When it comes to the example of oncology, so we know that some cancers are labeled and do have specific genes that put you at a higher risk category of getting them. It's important to note that they put you at a higher risk category, but they don't ultimately determine that you will definitely get that cancer. When we're able to map out the genes of the human body, we know that, as I said, some are very much associated with specific cancers. If you think about the BRCA1 gene, that's associated with breast cancer. We also understand that whilst there is a gene that is not in line with a specific type of cancer, it is a gene that can cause various different pathways to go off, which ultimately downstream can lead to cancer. One example is that we have genes, and our human body is very, very good at understanding the speed at which it needs to replicate. We know that there are genes that are involved in that DNA replication that essentially act as a braking system for that pathway. When this braking system is not working, the genes that are replicating, your DNA that is replicating, is going at an exponential rate, which ultimately can lead to DNA damage, which downstream can lead to things like cancers. So what we're able to understand for oncology patients is, firstly, why they may have got the cancer that they got. And secondly, what are some of the supplements and lifestyle measures, be that through diet, exercise, nutrition, that they need to focus on in ultimately preventing the reoccurrence of the disease. And if they haven't been diagnosed with cancer, preventing occurrence of the disease. So I mentioned before that I feel that this metabolic pathway is the epitome of preventative and personalized care. One of the reasons for that is that, as we know, each of these pathways is assigned an active ingredient that you can get from nutrition or you can get from supplements. Today, it's not unheard of, many of our clients presenting to us when they first come to us, and they are taking 20 different supplements for various different things, all in line with health span and longevity. Whilst that's great because it shows that they are super interested in making the right decisions and supporting their body with the nutrients that they need, we need to remember that supplements are not just the active ingredient that is in that tablet. A very small amount of that tablet or capsule that you're taking is the active ingredient, let's say vitamin D. The rest of it are things that keep it stable on the shelf, that keep it in the shape of the tablet, which we call bulking agents. So there's a lot of additives that are in these things. When you're taking 10 to 20 to 25 of these things, whilst you're getting the active ingredients, you're also getting a lot of other chemicals. And one of the things that we focus on at Longevity UK is to making sure that clients are taking the supplements that they need, and that's it, not over supplementing them. One of the values in this map is that once we can map out your metabolic pathways and understand exactly where you have some variances and understand which genes we want to turn on, which ones we want to turn off, which ones we need to keep on, we are able to basically come up with a formula that will include every single active ingredient that you need in a few capsules. So for myself, based on my map, I take 6 capsules a day, 2 in the morning, 2 at lunchtime, 2 in the evening. And those are the only supplements that I take apart from the additional omega-3s and everything. But the reason why that's super important is I know the formula that I am taking is in line with every single detail of my metabolic pathways. So my family has a strong history of cholesterol. I know that there are specific supplements that I need to prioritize to keep my cholesterol down. I also know that there are various things within my methylation pathways that require specific supplementation. So it takes the guesswork out, it takes the over-prescribing of supplements out, it takes the trial and error out. It gives me a formula where I am able to just take the capsules and take the nutrients that I need. So another case study and example of where we use this map as part of the Longevity UK programs is clients that have struggled with weight management. So we have a lot of clients that come to us that want to join the program, be that for gaining weight, be that for losing weight. Now, a lot of these people present to us having done many failed diets and are at the point where they just need to understand what works for them. They don't have the time for trial and error anymore. They also don't have the inclination for it. They want to find out why they have the stubborn weight that they can't lose, why they are unable to gain the weight as well. So this map really allows us to understand that. Not only are we able to look at things that are specific in weight management, like leptin, like your leptin pathways, but we're also able to understand through pathways in insulin resistance, insulin signaling, right through to cholesterol and inflammation, what are the things that are contributing to the client's symptoms of not being able to lose weight. Once we know this, we're able to get super specific with nutrition that they need to eat, not only their macronutrients such as their carbohydrates, their proteins, their fat, and the ratio of what will work best for them, but also the type of additional supplementation that they may need to, let's say for example, control the insulin resistance, or to help with the inflammation that's going on that is causing them to not get the desired outcomes that they need to. Okay, so one of the most advanced tests that we do at Longevity UK is called the Metabolic Pathways Map. So this is a genetic test that we do. From here, you can see that there are various different colours on here. The most important ones that we need to focus on are the green boxes and the red boxes. When we do this test, which is collected by a buccal swab and saliva sample, we're able to understand all of the genes that are expressed in the human body and how they relate to specific metabolic pathways. So if you're somebody that has high cholesterol and want to understand why you have that high cholesterol, if you're somebody that struggles with anxiety, depression, and all of those things that come along with mental health, and you want to understand why, this map allows us to do so. It also allows us to understand various risk factors. Maybe you come from a family that has a strong family history of Alzheimer's and you want to understand what your risk factors are. Once we do the test and we're able to map everything out, we're able to understand the specific active ingredients, be that in supplements or in food, that are linked to each one of these metabolic pathways. If we take the example of cholesterol, we know from a blood panel that your cholesterol is high. Why that cholesterol is high, we don't know, but what we would do normally as a first line is put you on certain drugs that's going to help control that, like statins. We are able to, through this map, understand firstly whether those drugs are going to work for you if that's the direction that you want to go into. But secondly, if you're somebody that wants to explore it through diet, nutrition, we're able to understand the specific supplement that you need to take that will help lower that cholesterol, removing the need for trial and error. This map, as you can see, links various different pathways and really nicely visually represents just how closely all of these pathways are linked. So if we follow cholesterol here, we can go through to inflammation, cardiovascular, weight management, insulin resistance, right through to thyroid and Alzheimer's, and then the various mental health pathways and also the methylation and longevity pathways. We're not fans of overprescribing supplements at Longevity UK. We like to keep it super simple and give our clients only the things that they need. This map allows us to do that. Instead of taking 20 different supplements that will target specific different pathways, we're able to create a formula, no more than 4 or 5 different capsules, depending on your pathways, that you take a day, which reduces all of that extra stuff that comes along with taking so many supplements.